Okay, so our next group here, we're going to have our final panelists of the day who we're going to talk about the amazing work being done by charitable dental clinics. This panel will be moderated by Dr. Perry. Sorry, I'm going to try to get there. Okay, Dr. Butler Perry is a dentist with an MSCS and an FACD, is an accomplished dental education clinician and community health leader, currently serving as an associate professor and chief partner officer at the Office of University Partnerships at A.T. Stills University. Her role emphasizes collaborative initiatives. Before this, she held a pivotal dual position as an inaugural Associate Dean of Clinical Operations at ATSU, Missouri School of Dentistry, Oral Health, and Dental Director, Vice President of Avina Healthcare, a federally qualified health center, community partner, demonstrating her commitment to accessible healthcare. And thank you very much, Dr. Perry, for being our moderator for this today. Thank you.
And thank you so much for the opportunity. So good afternoon, everyone, and welcome to the Arizona Oral Health Coalition's panel on the value and the why behind charitable dental services. Today, we will hear from three vital organizations dedicated to filling the significant gap in oral health access for underserved populations, including white, Hispanic, African American, and indigenous communities. As a past president of the National Dental Association and their past board of trustees, I firmly believe that oral health care is a right for all. Part of NDA's mission is to advocate to secure comprehensive oral health care for everyone. As a dental profession, we wholeheartedly support the efforts of these organizations presenting today. Recognizing the crucial role in providing essential care, as the Surgeon General Landmark Report in 2000 underscored, our overall health is linked to our oral health. The disparities in oral health across groups are stark, highlighting the urgent need for charitable interventions until more meaningful and equitable policy changes are implemented. The compassionate work of these organizations remains a crucial lifeline, providing essential care and alleviating suffering for those who would otherwise go without. Their efforts underscore the profound impact of dedicated individuals and groups in addressing systemic inequities and promoting better health outcomes for all. I'll share with you that today I attended the graduation of our first dental school here at A.T. Still University, which we call ASDO, which is Arizona School of Dentistry and Oral Health. And our students recited the oath of the health profession. And in that oath, we promise to put our patients first and advocate for their well-being. So this panel today will demonstrate how we as healthcare providers keep our promise to take care of and advocate for those who may not be able to advocate for themselves. I will start by introducing our panelists today. First, we have Ms. Colette Barr. Ms. Barr is a founder of the Arizona Healthcare Outreach. She is a dental hygienist and nearly 3 decades of experience in general and periodontal care. Driven by a commitment to service, she established Arizona Healthcare Outreach in 2017 to provide dental services to refugees in Arizona, building upon years of international dental work and mission work. Next, our presenter will be Dr. Gary Jones, a Northwestern Dental School graduate. He has practiced in Mesa, Arizona for over 39 years. He led Mesa's successful water fluoridation efforts. He has volunteered at local schools and held presidencies in the Central Arizona Dental Society and Arizona Dental Association. He's a founder of the Arizona Dental Mission of Mercy, where they have seen over 1,700 patients. He currently serves on Delta Dental of Arizona and leads the Arizona Dental Association Cares Foundation. Dr. Jones enjoys off-roading, golf, and flying. Last but not least, our third panelist is Mr. Jorge Herrera. Mr. Herrera has served as a Justice Program Director at the Regional Center for Border Health since 2016. He manages and coordinates services for individuals involved in the legal system, referred by various agencies and facilities. His role focuses on optimizing the functioning of individuals with complex needs through quality treatment and support, as well as supporting program development. Jorge holds a Bachelor of Psychology from Mexico and has served for over 20 years and has experience in behavioral health systems. I'd like to welcome our panelists for joining us today. So we'll have the opportunity to answer questions at the end. And if we're not able to do that, you'll submit your questions and our panelists will be happy to address them at a later date and get those answers to you. So we'll start with our first panelist, Ms. Barr. Ms. Barr, I have a first question for you. Can you tell us about your organization and the population that you serve?
Our organization consists of a grassroots movement started by the ASU School of Social Work Global Outreach, myself, and community leaders in the refugee world. We wanted to provide a bridge for refugees, asylees, and immigrants to be able to access oral health care. Unfortunately, they don't integrate easily into our healthcare system for cultural reasons, for transportation reasons. So we oftentimes the refugee will have dental pain and end up in the ED, the emergency room, where they don't have the facilities to be able to even diagnose oral health issues. I don't think this can be overstated. Later on in the chat, I'm going to send a picture of my sister. She's not my sister, but she's really my daughter's mother-in-law. A picture of what happened to her due to dental malfeasance. She's permanently disfigured. And her brain has been altered and her masseter was cut, so her opening is bad. We talk about smiles a lot. We talk about implications in oral health for the system, the body system, but we don't acknowledge that it can actually be a death that we're talking about. We want to provide emergent care, kind of a pop-up clinic, a way for people who are in real trouble in real time, because the ER cannot fix that. It costs us every time they go to the ER $500 to $3,000 per visit. They will give them a referral. They will give them pain meds, oftentimes antibiotics, rinse and repeat. So every time that happens, it's a very expensive, futile operation. So we're not a free clinic because we're a bridge. We want the refugee to learn that there's always a copay with dentistry. Dentistry isn't free. Even though it's very expensive for them, we charge $20. So we believe that if they have to pay for service, they will value their care. They will listen more carefully to the oral hygiene instructions. So some of our stakeholders, AT Stills is a big one. Dr. Mike Johnson from Spears Open Wide Foundation, Kent McKinley had provided legal advice for us. Mike, our IT guy, Mike McCarter, Dave Rosas, Patterson has been foundational. Dentists have volunteered and donated over $100,000 worth of materials and equipment to help fund. There's too many. Mickey Banks, the Rice Refugee Center, the ASU pre-dental societies, huge, and Lena Osmond. So that's Arizona Healthcare Outreach. Thank you. Oh, I forgot. We also run a bi-yearly visit to an outreach to Mexico, to Rocky Point or Sonoyta. We pack up our pop-up materials and we take it on the road. Last last time we went there, we helped 300 people with 40 volunteers. So it was an amazing outreach. Thank you.
Thank you so much, Ms. Barr. We appreciate that. Dr. Jones, and during this question, we're just going to take 2 minutes to get these questions. Now, we're still working on getting Mrs. Barr video up and going, but if we're not able to do that, we know she's there in spirit. So, Dr. Jones?
Thank you, Dr. Perry. Number one, I want to thank the Arizona Oral Health Coalition and all those that are attending this for your concern, for your desire to serve others, and to being a part of this very, very important topic. Right now, I'm serving as the AZOHC Cares Foundation president. AZOHC Cares was founded in 2023. It's a combination of actually 2 foundations, the Arizona Dental Association Foundation and the Central Arizona Dental Society Foundation. And so our main goals in our foundation is to serve those in need, adults, children, veterans, increase awareness about oral health, support dental education, and to deliver essential dental services to underserved communities throughout Arizona. Some of the events that we have been a big part of: Give Kids a Smile, Arizona Dental Mission of Mercy, Hope Fest, Veterans Stand Down. We've done veterans events with Phoenix College, new programs, Adopt a Vet, Adopt a Child, Guard Your Grins, where we're getting mouth guards that have been donated to us from Delta Dental out to Title I high schools and their athletic departments. And then Learn Right, Smile Bright, which is school-based dental education. So thank you for having us.
Thank you so much, Dr. Jones. Mr. Herrera?
Good
And same
afternoon.
question for you. Can you tell us about your organization and the population that you serve?
Yes, good afternoon, everybody. Again, also thank you, Arizona Oral Health Coalition, for the invite. This is the first time that Regional Center for Body Health participates in this amazing program, which we are very happy. So Regional Center for Body Health and its walk-in clinic is an integrated agency. We provide primary care services and also behavioral health services. We serve the South County area of Arizona, but we also have services in La Paz County and Mojave County. So we cover, the 3 counties. Like I mentioned, we provide primary care services, which are focused on pediatric, family, for the adults, internal medicine, chronic care management, OB/GYN. We have pharmacy. We have 3 urgent cares as well to serve those members that are in need of CL provider after the clinic hours or over the weekends. We also have a surgical center in our medical mall. This is a brand new building. Also, we have the diagnostic center services where we perform ultrasound and x-rays. We also have the speech therapy or the speech department and the children's dental care as well. On the behavioral health department, we also provide psychological evaluations. We also have psychiatric evaluations, psychiatric providers, counseling, obviously. We also provide skills trainings, peer support services, employment services for those ones that need, are in need of a job. We also provide case management services, ABA therapy, substance abuse, which include the motor recognition therapy groups, the relapse prevention group. We also provide domestic violence groups, DUI groups, and we have the amazing transitional living care program, which is the one that I'm going to talk about in regards to the oral care that we are providing to those members that we serve. And we serve, since we live in the South County area, most of our population is Hispanic. I would say about 80% are Hispanic. And the other, 10%, 20%, we also provide Caucasian, services, and also to the Native American population that live in the area.
Thank you so much, Mr. Herrera. And just listening to all of the things that you all have shared, I am a veteran, so I so appreciate the services that we are providing to our veterans. For my entire career, I've treated a pediatric population because I feel that the children are our future. And just listening to what you were just saying, Mr. Herrera, about the psychiatric or the mental health problems or challenges that we know that our patients face. And this is the same patient population that has pretty significant oral health needs. And so if you have the opportunity to review Oral Health in America that came out through the NIH, it talks about the social determinants of health. It talks about mental health and how it impacts our patient population. So we're going to go on to our next question. And Ms. Barr, you're up next. And so our question is, how have you been able to leverage community or external resources to increase your impact? And if so, what strategies have you found to be effective? And if we can take about 5 minutes or so answering those questions, that would be great. Thank you. Ms. Barr?
Thank you. Strategies. I started working out of boxes, and the funny thing, one of our biggest contributors, Dr. Patel from AT Stills, Dr. Patel, the dad, I met him at Arizona Mission of Mercy. He was the best extractor I could see. I could barely numb the patients. So I said, are you interested in helping refugees? And from that, we kind of formed an alliance. Dr. Patel has brought in AT Stills. He's actually facilitated D3 students to help with their learning experience. The D2s and the D1s come in as part of their community outreach program and learn what difficulties and hardships the refugees have, and also learn how we can help them by loving them. We reached out to refugee centers, the community leaders from the Congolese, from the Afghanis, from the Iraqis, particularly helpful. And in a coalition at first with the Rice Center, they helped find people. ASU has been instrumental in sending people. And the interesting thing that I didn't anticipate at first, but I've grown to love, is a lot of refugee families are sending their second generation children, because their hope is if they can become professionals, they can help the family culture to thrive. And so a lot of the people that we have coming from ASU have been either refugees, immigrants, or children of such. They bring translation skills to the community. They bring heart. They bring stories their parents are unable to tell because of the tender nature of being a refugee. We've had a relationship with Patterson. I literally went and picked up a sensor once a week or once every clinic from Patterson for free to use at the clinic. Phoenix Community Tool Bank provided x-ray equipment for a fee. Oh, there I am. Oh, that looks awful.
We're getting there.
Woo!
What we get.
Yeah, that's a scary thing. Okay, we're going to work on the video. My lips are on point. Okay. Community resources. We have dentists that come in frequently, and we are able to offer through the board continuing education. That has been foundational. One thing that I love is seeing the D1 and D2 students meet with our ASU students and coach them and give them hope and tell them how to work on their DAT, provide them opportunities, tell them where to volunteer. It's quite a coalition. So those are some of the things that we have. We also partner with Roy Bryant. Alas de Amor is his nonprofit. He's been going to Mexico for 10 years. And that's quite an outreach. A lot of the people from the clinic come down and are able to do more and see more. dental. Oh, there. Oh, that's what that was scary. Ooh, that's scary too. Sorry. You laugh or you cry. Deb Kappas, you have to move with it. Um, we're looking at other coalitions with the Alex Kim Foundation. Alex Kim is reaching into a multidisciplinary atmosphere. We're going to be allowing our refugees are going to be going into their medical clinic on Monday through Wednesday. We will be getting all the vitals, including something that I consider to be elemental in dentistry, an A1C. We need to know the blood sugar status. What are we doing? What are we doing treating people without knowing their medical histories thoroughly, and they can't provide that. So they don't even know what an A1C is. I'm excited for this collaboration. Another thing that we have coming up is we have a motorhome that was donated to us. So we're taking this on the road. We don't know exactly how that's going to work. We have Derek Burr, who is a veteran himself, who is passionate about veterans care. So I was totally interested at that last presentation. We have committed to running in the beginning 2 veterans only events. So we're pretty excited about that.
Thank you. Thank you so much for that, Ms. Barr. Just listening to you, what I heard was whole person healthcare.
Yes.
That's what I heard. I heard that you're taking care of the mental health, the physical health, and we're looking at the social determinants of this patient population. And when you bring over or you begin to engage refugee populations, it's just not about teeth. So I do appreciate that. And the other thing I just love is that you all are focusing on diabetes. The Surgeon General told us in 2000 that there was a connection between diabetes and oral health. And we know that here in the state of Arizona, the cost of treating the diabetic patient is close to $6 billion. So I thank you so much for those efforts. We're going to go on to Dr. Jones. So Dr. Jones, does your clinic gather let me back up a little bit, getting a little excited there. Have you been able to leverage community or external resources to increase your impact? And what strategies, right, have you found to be effective?
First of all, I think it's important that we identify that there is a need, because when we can identify a need, then we can gather those around us to take care of it. It's also important to organize an event or something that take care of that need, because we've always said that action creates excitement. When you have something that's planned and you trying to get people together, if you have an event, that action creates excitement. We also invite others to join in serving and giving. We need money and providers and a location and supplies, and all of that is very essential to deliver the care that we want to do. And sometimes financing can be a problem. It's a concern. One of our founders of the Mission of Mercy said, it costs a lot of money to provide free dentistry. And it really, really does. And getting the providers there, we want to make it as easy as possible for them to attend, take care of them while they're there, and then also give them the opportunity to serve in their own offices and take care of patients in their own offices. So it's important that we combine resources. For example, when we started Give Kids a Smile back in 2003, we started the Phoenix Boys Club downtown, and it was small, but it was effective, and we really moved that forward. Now we're working with Midwestern, AT Still, Pima College. All those are doing the Give Kids a Smile programs, and it's really functioning well, where $7 million of care have been given to 20,000 children over the years. I mean, an amazing program. We've got the Arizona Dental Mercy that we did for 11 years, approximately 1,800 patients per year, and around $2 million of dentistry done in the 2 days. It was amazing. And, to do that, we needed the Arizona Department of Oral Health to come through to help us with the Coliseum. Delta Dental was instrumental in giving us the seed money to start the whole program. Without Delta Dental, we could have never done it. And then Of course, the action creates excitement, where a lot of other people started to come and to see what we're doing and join in. And Delta's been supportive the whole way. Legacy Foundation also. Oral Cancer Walk, started by Dr. Terrence Yu, and dental students at the Phoenix Zoo were a part of that. We combine resources to take care of this population and to give the people what they need. Strategies for effectiveness. Number one, we talked about how important it is to invite those to the event that fund the event. I'm telling you, when they come and they participate and they see what's occurring when we're taking care of underprivileged individuals, everyone wants to return, to be there again, to help support it in the future. So again, invite those who fund the event, invite politicians so that they can make decisions legislatively that will take care of those individuals. I used for the Mission of Mercy, I would set up the dental clinic physically, and I'd go down. We would start Friday morning. I'd go down Wednesday night, and we had a line of people that were camping out to get in there. And so the demand is high, and for the legislators to come in, see the event, and see what's occurring, and see the need, I think it helps those that are looking for legislation for Medicaid for adults, because they only have an emergency benefit at this point, to really kind of take a look at what the needs are. Invite the media. Video testimonials of those that have been served are hugely powerful. Hugely powerful. When they get on the video and they say, I had this abscess and I needed it taken care of, and I've been in the emergency room 4 times, and it took an extraction of that tooth, and now I can be healthy again. I mean, that's a huge deal. And then I think it's also important that we have a continuity of events where we continue to do it. We continue to have those events where people can join, they can become a part of it, and that's where we get our strategies for effectiveness and success.
Thank you so much for that, Dr. Jones. I just love, what you said about action creates excitement, right? And I just really believe that it is our responsibility as healthcare providers to get our patients free of disease and back to form and function. So it really sounds
absolutely. Thank you.
That is the work that's being done. And just want to share with you 2 things that you brought up, Mission of Mercy. So I was a faculty member at Baylor, and I drank the Mission of Mercy Kool-Aid, right? And I went and got excited about it. And right around 9/11, a lot of people lost their jobs. Kids had fallen through the cracks and couldn't get Medicaid and things of that. And I happened to be at a church where there were like 5 dentists. Imagine that, right? And got some funding from Give Kids a Smile. And one of my colleagues opened up her private practice, and for 4 months on a Saturday, we brought underserved children in. We did pulpotomy, stainless steel crowns, extractions, whatever those children and their families needed. And Miss Jones doesn't just bring little Susie. She brings the whole family.
Of course.
We had to feed them because the church brought them in the church van. So I totally get, but I drank the Kool-Aid, and what you're saying really, really does resonate with us. So thank you so very much for that. Mr. Herrera, so you're up next. Have you been able to leverage community or external resources to increase your impact? And what strategies have you found to be effective?
Yes, thank you. Well, like I explained at the beginning, Regional Center for Border Health and Specialty Clinic cover the rural area and the southwest of Arizona. So we all know that in rural areas, it's very difficult, right, to get, resources, and also to get, some programs work for the community, especially for those members that we just mentioned, or you just mentioned, about the to cover the social determinants of health, right? That everybody, is going through, especially those members that we serve in the TOC program, which is, mainly members with opioid diagnosis and substance abuse, including, all kind of substances. So because of that and the opioid, effect and the need and the service, Regional Center for Border Health, we start developing this program, the TOC program, back in 2018. So since there, the agency was absorbing all the costs for assisting, I mean, these individuals, specifically with dental care, right? Which is one of the areas that they in their health that they get more affected, right? Because of the use of the substances, and also the limited resources that they have or that they're not aware sometimes that they're in the community. And also because, I mean, since they are involved in substances, they don't see the need to see the providers, right? Including the medical providers, right? So they can, when they come to us, we address those areas, the medical area and also the behavioral health area, all the social determinants as well, to identify what are the needs that those members have, and start referring them to the resources that we have here in the community. And if there is no resources in the community, we look, I mean, outside of the community, right? And if we have any programs that we can implement, we develop, I mean, those programs as well, right? So like I mentioned, I mean, since 2018 that the program was developed, we already serve about 184 members in the program. This program is based on intensive substance abuse treatment, intensive outpatient substance abuse treatment, including, I mean, like I said, all the medical treatment and the behavioral health treatment with the agency. We have 7 homes here in the area. We have 3 homes in San Luis, Arizona, which is very close to the border. If you guys are familiar with the area, very close to the border of San Luis, Mexico. And then we have, I mean, another 4 homes in Somerton, which is, I mean, our headquarters offices are. And we also have another 4 tiny homes in Parker area. So we serve, I mean, we place 2 members on each one of the homes. We immediately schedule them with the medical provider to, like I mentioned, to identify any possible need, any need. And obviously with our dentist provider. We have a dentist provider here in our office, in our clinic, that he assess, I mean, the members, and if there is any service that can be provided and can be covered by their insurance, we can assess them with that, or we can provide the service. We know that, I mean, some services regarding to dental treatment are not covered, right, by the dentist provider. So we start absorbing those costs, and we start sending them to the specialists here in the Yuma area. And also, since we are very close to the border of San Luis, Mexico and Los Algodones, we partner with some of the dentists in the area. Also, since we have this program that is called CAPAS. CAPAS is a program that was developed also by the clinic about 25 years ago, with the collaboration of the doctors in Mexico, and also doctors from here from US. Those services that those medical providers provide, the members get a discount on the services. So it goes from the 35% all the way to 80% of the fee. So they get a lot of benefits with this program, right? Especially for those members that doesn't qualify for medical assistance. So we partner with those dentists provided in Los Algodones and also in San Luis, Mexico, and we'll start taking those members to there, so they can get the treatment. We know that because of the substances, the first thing that damage is the teeth. So some of them, they being needed the whole extraction and replacement of all the teeth. Some of them, they just need some kind of minimal treatment, right? Which is also something that we address. So on 2023, Regional Center for Board Health partnered with the with Banner Community Reinvestment Program to obtain funds. So we applied for this program. We got accepted, and with the funds that we're getting from Banner, is being more beneficial for those members, right, that we have in the program. And now we have the opportunity to serve more members, right? And some of them are not on the TOC program. Just, I mean, they are in our substance abuse programs or groups, and we identified, right? I mean, that need, and not only for aesthetic, I mean, right, but also because it's medical need, right? If
Yep.
they get an infection, if they get, I mean, if they don't get the extraction, I mean, immediately, I mean, it can be worse, right? They can
Right.
end up with a worse, I mean, a medical problem, right? So
Absolutely.
we don't focus on just, I mean, like, okay, we want for you to have a beautiful smile, which is, I mean, one of the goals, right? But also we
Absolutely.
want for you to be healthy, right? To be
Yeah.
healthy, and also because we are helping them to transition back to the community, and helping them to get employment, to get their self-esteem back again,
Right.
to gain, I mean, that trust, I mean, of them as well. And also because they're gonna have interviews, right? We want for them to feel right, I mean, comfortable and secure that they can go in front, right, and perform the interview. I mean, like that they know, right, and the skills that they have. So that's what we are focused on that. So those strategies those are the strategies that we found effective. I mean, take care of the dental care, right, to increase
Take
their
care of their
self-esteem.
care.
Yes,
That's right. Give them the
motivation,
health
the
care
secure
they
their
need.
personality. Yes,
That's right.
feel more comfortable in the society. Also, I mean, speaking in public, I mean, some of they become a peer support certified. We have about 12 members that were in the TOC program that they're now working for the company in the front desk area. Some of them, they got the certification as a medical assistant because we have the college and health career also that we enrolled them. So it's been very helpful.
Absolutely. Well, thank you so much for that. And we're getting really tight on time, but I would love to see if we can just kind of quickly just share on the last question. So does your clinic gather any feedback from the communities that you serve to ensure that you're meeting the oral health need? And if so, could you just quickly share with us what that looks like? Just take a minute or two, and that we would appreciate that. We'll start with you, Ms. Barr. Uh-oh.
Sorry, technical difficulties. Initially, since we were set up with ASU School of Social Work, and they had all these rubrics and all these things, and we've gotten away from that. Recently, AT Stills and I, in our collaboration, shared some information, some constructive criticism. I jumped right on that and answered back. I saw some blind spots in what we were doing. And so moving forward, we're going to have a suggestion box for people who aren't collaborating with AT Stills because they already have a feedback system, and we'll be working through that. It's a very loose thing and something that we need to certainly pick up. Thank you.
Absolutely. And thank you so much for that. Dr. Jones?
I think it's really important that we include demographics in our registration. It's important to know who we're serving.
Absolutely.
I think we need to get age, race, dental needs, income level. Are they a veteran? How many times have they gone to the emergency room for treatment? This helps us with grant applications, legislation. It helps us for next event coordination. For example, when we started the Mission of Mercy, we did basic services, hygiene, extractions, restorations, and full dentures. We added root canals, crowns, partial dentures over time because of the need. Follow-up. Sometimes we need to know who got extractions and how we can get them into another clinic for a full denture to restore them, because sometimes we can't do it. So follow-up is really important, a part of that demographic that we need to get. Sometimes we have too many patients that show up. So we do blood pressure, temperature, glucose, radiographs, and a dental consult. If that's all we can do, that's a good start for these individuals. And then I think it's also really important for the demographics that we get post-op interviews, like I talked about. How were you treated? Importance of getting treated medically and dentally. Would you come again to our event? And what can we do to improve this event? So all that demographic all plays together on our planning the next event and making sure that we're taking care of those that we need to.
Absolutely. Thank you so much, Dr. Jones. And last but not least, we have Mr. Herrera. So if you can share with us, are you gathering information from your community to identify or get a good feel for what their oral health needs are? And how are you using that to shape the services that you're providing? And we'll just take a minute or two just to be able to share.
Yes, yes, we're very grateful, with the feedback that we're getting from the community. Like I said, this is helping a lot for those members that live. Most of the members are here from the area. So seeing, those members providing our feedback, saying thank you. The program helped me. The treatment care that you provide to us. It's been something that I was looking, from before, from years. I was so embarrassed, right? Before. Now I have, a beautiful smile, a big smile, right? I feel very confident. I can go out. Others, like I said, they were able to obtain a job and perform very, very, very well. Successfully, to the point that we even sometimes we get, the feedback from their employers, saying that, that employee, improved a lot. Also from the counselors, because they're seeing that they're more open in counseling sessions as well. They're more open, about their needs. And that is obviously, something that help us to continue working. And like I said, if we don't have the funds, Board Health will jump in, right, and cover the fees for those treatments.
Absolutely. I just want to thank each and every one of you for the work that you're doing out in our community and what we heard today. And just know the dental profession and our other professionals, we are so grateful for the work that you're doing. And one thing as a researcher, we all wear different hats, and community participatory research says to us, we never go into the community and tell them what they need. We try to engage the community and say, how can we be of assistance to you? And so I love this last question. And I love that you guys are hearing from the community and tweaking your services to be able to meet the needs. So I just want to thank everyone who took time out of their day today to come and join us to hear about the work that these amazing groups are doing. And I just want to say that hopefully that you would have a great rest of your day. And thank you for this opportunity.